This one shouldn't be too long. All right, so this is session 2. And session 2, I'm not going to go through this because you already know this. And so this is just an appreciation to partners who have helped in our work. Okay, so we talked about adverse childhood experiences last time. And this time we're going to talk about adverse climate experiences and adverse community experiences. And just to remind you, adverse climate experiences are those that are at the top that have to do with environmental injustice, drought, fires, climate change, hurricanes, pollution, COVID-19, and floods. And then adverse community experiences, which are also known as the social determinants of health. So here we have one slide on adverse climate experiences. So one of the most devastating examples that we have of adverse climate experiences is Hurricane Katrina. And I'm not sure how many of you remember Hurricane Katrina. I'm sure that all of you do. But what you remember, well, tell me what you remember about Hurricane Katrina, and you can each just answer briefly.
That's for anybody?
So, okay, so I'll call on Alicia, then Hope, then Nancy, then Angela, then Brittany. So Alicia, you can go first.
What I remember about Hurricane Katrina was the levee broke and there was a lot of lives lost in the poor community areas. Mm-hmm. Is what I remember.
Yeah, thank you. Hope, yeah. What about you? Thank you.
Yes, a lot of trees down and, you know, falling on houses and, well, the property damage and things like that, just as Alicia was mentioning. Mm-hmm. The nature that took the impact and then fell on property and damaged property in the homes.
Thank you. Nancy, how about you? What do you remember about Hurricane Katrina?
I remember about Hurricane Katrina being a catastrophe event for the community, with that community being destructed by nature. With that being said, also the people that suffer the most by that consequence was the minority community. Mm-hmm. The disparity, I noticed that disparity was directly to people who were unable to get back anything, if anything, from insurance, home insurances, life insurances, or any kind of insurances that had to cover them was no near to be found, and therefore a lot of people moved to other locations, such as, I remember back then I was living in North Carolina, and we had moved to a city in North Carolina that was smaller, and even though the town was very small, a lot of people were coming from there due to Katrina. Mm-hmm. Because there was nowhere, there was no safe location, especially for people who do not have the resources to do so.
Thank you. Angela, how about you?
Yes, I remember that there were a lot of misplaced people, individuals, families, and they were they pretty much had to leave the state and go to different states, and you know, a lot of organizations were sending water and whatever help that they could assist with. But there was just a lot of needs. The whole community was pretty much misplaced.
Absolutely. Thank you. Brittany, do you remember anything about Hurricane Katrina?
Well, I believe when when the hurricane happened, I think I was in Virginia. That's where I was living at the time. So I do remember whenever we got hurricanes, it would rain a lot. And I remember it was a lot of flooding. So a lot of damages to apartments. Whenever it would always come inland. The water would always come inland. So a lot of times when hurricanes hit and came near where I was living, me and my mother would have to evacuate. So a lot of people in the communities or minority communities would have to evacuate from their living places. So it was very, like, I guess, annoying for people who didn't have time or didn't have the opportunity to just up and leave and go to somewhere else that's dry or whatever the case may be.
And thank you, Brittany. And Marcella put in the chat, all the flooding and people left homeless. That was true. Hurricane Katrina was probably the worst disaster that there's been in the United States. And because so many Black people were impacted by it, one of the first things was they really didn't have a way to get out of there. So the levees in New Orleans were supposed to work so that it would keep the water from getting over and into the community. And the levees broke. So all of the water went into the community, and the first ones in line were Black people. And if you ever, there are documentaries on Hurricane Katrina. It was so terrible. Because the floods went all the way up to the tops of the roofs. So people had to, if they could, but a whole lot of people died and drowned. But if they could, if they got up to the rooftops, then they had to wait there until whatchamacallit, I'm sorry, what you call them things?
The helicopters?
Thank you. Until the helicopters could come and pick them up. And then on the ground, they all had to stay in the convention centers. And, it was horrible in there. There was a lot of crime. Children got raped in there. It was horrible. And I think that, unfortunately, the United States, and Bush was president at the time, but he didn't even go for a long time to check on the people. And it was really bad. So hold on a second, I have to cough. Just one moment. Okay. So it was hard. It was so horrible. And like many of you have said, they had to leave. But when they left, they didn't leave with anything. So they were allowed to go. And I think that hotels were supposed to allow people to stay in hotels in other places across the United States. But, and I remember that we were at a hotel when some, people were coming in, and they were saying, that they were supposed to be able to stay there free of charge. And the folks at the front desk were giving them a hard time. And so I remember, that I just said to Earl, I said, can't we just pay for their hotel stay? And, just when we were getting ready to do that, they got it. It was cleared up. But so the problem is not only that the floods happen, but first of all, people can't get out. Systems that they have to warn people don't necessarily work in Black communities. I mean, so it's really bad. And the other thing has to do with COVID-19. And, has anybody on this call lost anyone due to COVID? I have 2 cousins that passed away due to COVID. How about anybody else?
My aunt died due to COVID.
Okay.
She died that when it was freshly new, and it was really horrific because it was just the way I felt like it was very inhumane, and due to the natural ways how when someone dies, what we do, it was just very saddening, very different. It was scary. Most importantly, it was scary.
And so, I mean, people died all over the United States, and 13,000 more Blacks would be alive today if they were cared for the same as white Americans. And so that's why we have to watch out for each other. We really have to look out for each other because, unfortunately, the system does not look out for us. And yes, Brittany has in the chat. I also remember Bush leaving for vacation. Yeah. And also Marcella put in the chat, the roof collapsed on the Coliseum. So it was a terrible, terrible, terrible situation. And even though it's hard to watch, if you're ever able to watch a documentary, or maybe I'll just send something for you to watch. It's not too long, so that you can understand the impact of adverse climate experiences as we're discussing tonight. So in terms of our community here and communities all across North Carolina, it doesn't matter what county you live in, you probably drive through certain areas that don't look like places that you would want to live because there are poor performing schools, no grocery stores, no banks. It's not safe even to walk in the middle of the day and that kind of thing. So these are built communities where there are problems and where challenges are greater because people don't have what they need in order to be healthy. And so a couple of areas in Durham are Eastway and Franklin Village, Old East Durham, Hoover Road, but I could have selected anywhere. And this image came from Durham Compass. And what they've done is to identify the census tracts, which are the communities where people live. And you can click on the map and this data will come up. It's not the same in other communities, unfortunately, but they do have, and Hope, I'm sure that the health department has this kind of information in their community health assessment because that's something they're supposed to do every 2 or 3 years. And Angela, are you looking at Wake County or Durham or both? Angela, yeah. You're muted.
I'm sorry.
That's okay.
You said you're asking me, am I looking at?
Oh, I'm sorry. Are you based in? I should have said, are you based in?
Oh, I'm in Durham.
Oh, okay. Woohoo. Okay.
I live in Durham. Yes, ma'am.
Okay, thank you. And so, so this is some data about where we live. So who lives here? And these over on the left-hand side are what are vulnerable communities in Durham, and you can see where they're listed. McDougal Terrace is in 1400 South Side. Well, you can read it for yourself. But what's so important about those places or these communities is, first of all, it's the built community, the built community. It's not the people, it's the built community. So the built community is built and then people move there. So if, you know, when you think about, and I think gentrification is something that's happening across North Carolina, all counties, all cities. And you think that if there's enough money to build $1 million, well, no, $2 and $3 and $4 million condos, then certainly there would be enough money to assist people that are living in vulnerable areas. But, you know, it's more about making money than it is about uplifting a built community. So, for example, some of the things that can be tracked in some of these communities, you see here. And this was a while ago, but it really hasn't changed. If anything, it's gotten worse. So there are more drug arrests, more air polluter stuff going on in the air, which is what a climate experience, cost burden households, and more eviction notices. And in some cases, there were 52 drug arrests per square mile in this particular area. So does anybody have a question or a thought about where people live? And, you know, I mean, people cannot be healthy if they don't have access to the things that lead to health, right? So, you know, okay. Okay, so then social determinants of health. That's what the big word is, but this is what it means. And some people call it drivers of health. So basically, this is what people need in order to be healthy. Under economic stability, they need employment, a good income, ways to pay for what they need. They need to get out of debt. They need to get medical bills paid, and they need support. Under neighborhood and physical or built environment, housing, transportation, parks for recreation, playgrounds for children, walkability, and you can see the difference in zip codes and geography. So that's neighborhood and physical environment. And you see that white bar that says racism and discrimination, because what happens is, because of racism and discrimination, then Black and brown people do not have what they need. So under education, literacy, language, early childhood, vocational training, higher education. Under
Write down your spell words, please.
under,
and then we'll go over them.
under food.
Don't you got math?
I don't know who that is. Okay. Under food security, access to healthy options, which in built communities is not there because there's no grocery stores, no access to fresh produce. Nancy, you had your hand up.
I do want to comment on what you were saying later on, but I also wanted to add that it was Ms. Graves that just joined us. I think her microphone was on.
Ms. Graves needs to complete session 1 before you can go on to session 2. Okay. All right. So Marcella mentioned in the chat, Oak Street Health has closed the office in the village because of violence and 4 deaths in the village in 10 days. Is that recently? Or over time, this is what the problem is? I'm waiting to see if she can put that in the chat.
I wanted to add, if it's okay, Dr. Boone.
Oh, yeah, yes, please. Okay.
I wanted to add that not having healthy grocery stores where we can find healthy food for us can definitely bring consequences to our health, not only physically, but also mentally. And that's very scary. And I wanted to add what Marcella was saying, is that has to do a lot with not being healthy enough, that basically we are there's a lot of distress, and because there's a lot of distress that comes to violence and stuff like that. Also, is very weird how they just put more of like alcohol and tobacco stores other than just grocery stores.
Mm-hmm. Yeah, that's true. Then under community safety and social context, social integration, what that means is that you have people that may have more than you do or who can help out. They may know of where a job is. And because of relationships, then you can get a job because somebody knows who you are. I mean, that's how a lot of people get ahead, is because of who they know. But in Black and Brown communities, you don't see that very much. And unfortunately, some people who do have some things in Black and Brown communities do not reach back out into the community in order to help others. Support systems are not there. Community engagement doesn't happen. There's a lot of stress, exposure to violence and trauma, policing and justice policy. Let me see. Marcella. Oh yeah, Marcella says, okay, let me see, okay. Carrying us, okay. Oh yeah, tobacco stores now outweigh grocery stores, with 4 in Lakewood near Food Lion. Wow. And then the healthcare system, people don't have health coverage. There may not be access to a pharmacy or access to, in the medical system, if you go to the doctor, sometimes the doctor talks down to you, or they're not really paying attention to what you're saying. They act like they're irritated with you and that kind of thing. And so it's really hard to get anything done in order to help you, because, you know, they have challenges. Crystal, I'm going to have to ask you to leave, please. And then I sent you an email because I look forward to you getting with Nancy or Stephanie so that you can participate in session 1 before you continue in session 2. Okay. Let's see. Okay. And so these are what's called the social determinants of health, or the social drivers of health. And so that's what we're talking about tonight. Okay. So health and well-being is impacted by this. More life expectancy. Now, we learned in adverse childhood experiences that there's also a problem with life expectancy because of ACEs, but there are problems with life expectancy living because a person may live in a vulnerable community or a built community that does not have what they need. I was talking to a physician recently about diabetes and different treatments for diabetes or how physicians look at diabetes. And sometimes physicians won't look at some natural remedies before they give medications. They may not talk about the adverse experiences that can be felt because of a certain medication. And in the Black community, more doctors resort to amputations than treatment. Not good at all. Not good at all. Let's see. So Marcella says, we have basically no community policing except McDougal Terrace. Brittany says, minority women who are pregnant are treated differently. Oh my goodness, that's true. And if you're a Black woman, I mean, you remember what happened with Serena, because she's, and there's also a documentary about her, because she knew something was really wrong in her body, and the doctor, I mean, she's a millionaire. She's the greatest athlete that ever lived. And, you know, they didn't pay any attention to her. So that's so true. They absolutely do not. I tend to look up things myself and read. Sometimes that's what you have to do. And Nancy says doctors seem to also resolve everything with more and more medication. And sometimes there's a stigma wherein Medicare or Medicaid is presented. I think I got everybody's comment in the chat. Thank you so much. So community of color have been systematically marginalized through decades of criminalized response to addiction, but also the problem with healthcare and racism. So this points out exactly how bad it is in some neighborhoods when you look at one neighborhood versus another. And so if you have transportation, one of the things that I would like you to do is to just take a picture of a healthy neighborhood versus an unhealthy neighborhood to submit as part of your homework. Okay, Marcella says, minority women are treated differently, but Hispanic women are treated like royalty. I've seen it happen. Thank you. Okay, in a recent survey, the reality of disparities in certain communities was made clear. What must be done and how quickly can it be done to empower the members of these communities to change? So for example, in census tract 11.00, it's 20%, 20.6% white, 57% Black, 20.5% Hispanic, 1.5% Asian, and 0% Native American. In 20.08, it's 77.6% white, 9.7% Black, 3% Hispanic, 4.7% Asian, and 0.56% Native American. And look at the difference in life expectancy. So in 20.08, people live until they're average 79.9, where in 11.0, it's 64.3. And that's a difference of 15.6 years. In terms of health concerns, in 20.08, 7.5% of people have diabetes, and 17.3% have diabetes. So you see the disparity, and that's because people either do or do not have access to what they need to be healthy. Food availability and access. You can see this where, there are more fast food and convenience stores in 11.0 than in 20.08. Banking and safe outdoor space in 20.08, located near banks, 1% of households, 2.17 of households in a community are located near banks, and 1% of households in 11.0. Now, that doesn't seem like much of a difference, but what it is that people in 20.08 have transportation to drive to a grocery store or a bank. Safe green outdoor space. 14% of households in community 11.0 have access to safe green outdoor space, while 62.6% of households do in 20.08. So one of the other things is that when there are trees in neighborhoods, even in urban communities, it really not only does it affect the mental capacity of people, it just makes people feel good, but also it's very healthy. And so planting trees or having trees is really important as well. Just one second. Okay. When we were in Seattle last year, it was probably the most beautiful downtown I've ever seen because they have trees growing everywhere downtown. And there was just a sense of safety, and it felt so good to be there. Fresh air downtown even. So the facts presented clearly show that vulnerable communities carry throughout its members' lives poorer access to food, financial awareness, and safe spaces from a young age are often carried throughout lives and lead to shorter life expectancy. With information like this, the question of what must be done partners with the question of, if not now, when? And so these are just some programs that T.R.Y has to help in some of those areas. And that's it for this evening. So does anybody have any questions or any further comments that you'd like to share before we close tonight? As you could imagine, homework is going to be really short.
Well, what I wanted to share was when I did the ACEs, adverse childhood experiences with my individuals, like me, they were surprised or that the climate was included. And know if it's true or not. I said, well, Dr. Boone, I think that's something that she brought forth. Really, because I had not heard it before. Even though it's what we've lived and it's what happened, but to really identify it, that's what was so compelling about when I shared the PowerPoint. That number one thing, and I think it's what I put on the homework, was always shocked about adverse climate. Defined as even though, like I said, we lived through it.
Right, yeah.
To make it Yeah.
Yeah. And, you know, when I think about it, I know Brittany had her hand up. There are a couple of comments in the chat. Earl is from New Bern. And so the last time they had a flood there, this is downtown. So most of the homes are older downtown. And his aunt, who's like 85 years old or something, sat on her refrigerator until somebody came and got her out of there. And her home is still not fixed. And I think that was 4 years ago. And then I think what it is, and she's downtown, and her house is one of the ones that are remaining in that area. So they want to tear it down and build up $1 million condos. Okay. So Brittany says, yes, Cornwallis doesn't have well-kept parks. The play areas are worn down. It seems like more boxes.
I was saying more,
Sorry. Go ahead.
to me, they're like little box apartments being built everywhere,
Oh,
and
yes.
they're super expensive.
Mhm.
And the cost of living, of course, goes up, but
Mhm.
you have all these condos and condominiums and boxed apartments
Right. Yeah.
literally in the little Hayti area. Those apartments look like the apartments you see in the movie on Pets. And
Mhm.
it's just like, who can really afford to
Mhm.
live in these apartments? And it's just like the people who live in Cornwallis. And I had some experience myself where, it shouldn't be where just because you live in the community, everyone treats you, or you're
Mhm.
treated the same. You
Mhm.
should not be treated the same. You should be treated as your individual self, because you might not think the same way as your next door neighbor or whatever.
Mhm.
But that's how you're treated. You're treated like you think the same just because you live in this state. Some
Mhm.
people live in these apartments just to move on to the next thing
Right.
and to better themselves. Some people live in here and they never move out, which is a sad case to me. But like I said, everyone thinks differently.
Yeah, I think that's one of the most horrible things that has always troubled me, which is why Earl and I both, I mean, we have friends who live everywhere. So, but unfortunately, that is not the case. Um, so Marcella writes, has anyone heard what Durham is doing about mental health? I heard they are supposed to start tomorrow. Where? I have no idea. I haven't heard anything. I'll look into it um, to see what's going on, but I haven't heard anything about it at all. Anybody else? No? Okay. Well, let me see. There may be. Oh, okay. I guess that's it then. So let me ask this question because I want this to be as comfortable as possible. So having homework due like today's Sunday or let's say Monday by noon, is that okay with you or do you need more time? I mean, most of you got it in, so it seems okay.
Sunday was fine. What's the homework again? Are we going through the slides again?
Yeah, it's always going through the slides and there may be a video. The only other thing that I asked for this time is if you have transportation, this is not like if you don't do this that you won't get a good grade, but if you have transportation and you're able to take a picture of a neighborhood that's not healthy versus a neighborhood that is healthy, that's the only kind of other thing. It reminds me of when we went to Birmingham, Alabama. I have never seen an area like this. It was so horrible. Everything was boarded up, and you just saw people like just walking back and forth. I mean, there wasn't a way for them to get anything. And then when you turn the corner, then on either side, you had grocery stores that were boarded up. It looked like family-owned restaurants and things like that, all boarded up. And then if you look straight ahead, there's the big, beautiful, shiny city that you can see right there before you. Oh my goodness, I thought that was so horrible because it's like, who can attain that, you know? So Sunday seems fine. Oh, so what I was saying that homework will be due on Sunday before our Monday class. Sorry, I'm gonna cough again. I'm trying to find my mute. Where's my mute? Your hand is up, Brittany. Go ahead.
No, I need to take it down. I'm sorry.
Okay, so what I was saying about homework is that it'll be due on the Sunday before this Monday, or even if you have to turn it in on Monday at noon, okay? So you can have that much time. It'll follow the same pattern where you'll have the slides, and then you'll have certain questions to answer that will be in the slides, just like the last homework was. So no surprises, no like gotchas, or anything like that. So anything else?
No, ma'am.
Okay, thank you so much for being here. I'll see you next time.